So let's move on to one of everyone's favorite vitamins, vitamin C. The NIH recognizes vitamin C's potential, but is not willing to recommend it, but notes that it's being studied. Okay, I'm going to read this to you because I think it really says, hey, this is going to be good stuff. It says, vitamin C is a water-soluble vitamin that is thought to have beneficial effects in patients with severe and critical illnesses. It is an antioxidant and free radical scavenger that has anti-inflammatory properties, influences cellular immunity and vascular integrity, and serves as a cofactor in the generation of endogenous catecholamines. Because humans may require more vitamin C in states of oxidative stress, vitamin C supplementation has been evaluated in numerous disease states, including serious infections and sepsis. Because serious COVID-19 may cause sepsis and acute respiratory distress syndrome, the potential role of high doses of vitamin C in ameliorating inflammation and vascular injury in patients with COVID-19 is being studied. And yet, what's their conclusion? Insufficient data. And yet, FDA has approved vaccines for emergency use on the basis of extremely limited preliminary data. The vaccines are a whole new type of treatment. Long-term safety and efficacy remain unknown. Vitamin C has a track record for safety and efficacy that goes back to the 1940s, when Dr. Frederick Klenner was curing polio with high doses of intravenous vitamin C. It appears that the NIH, FDA, and CDC are willing to withhold life-saving treatments under the guise of, we need more data. Financial interests are the only possible explanation. So let's talk a little bit about vitamin C. Humans cannot produce vitamin C. Animals, most animals, except for a few, including guinea pigs, maybe that's why they're guinea pigs, increase their production when they're stressed and ill because they can make their vitamin C. So for example, a dog that normally produces 2,000 milligrams a day when he is stressed or ill will produce up to 18,000 milligrams per day. This has been measured and studied. So vitamin C has been shown to be beneficial at almost any dose, but it has a stronger effect at the higher the dose. Oral doses can generate useful levels, and they can prevent infection and expedite recovery. Absorption of vitamin C increases during illness. So we actually have vitamin C receptors in our gut, and when we are sick and we need it, the body turns these receptors on and saying, hey, whatever C is coming through, I want it. Okay? When we don't need it, the receptors stop picking it up, and so it all puddles in the gut, and then you can get some gurgling and maybe a loose stool or so. So that's what we call vitamin C to bowel tolerance. Your bowel will tolerate what you need, and it will absorb. So if you push your vitamin C intake to that point, your gut will say, okay, I can't handle anymore. The body's not absorbing it. So it'll give you a signal. You'll know exactly how much is enough. Intravenous doses of vitamin C produce much higher levels than oral doses. We know that too. So vitamin C has been proven to inactivate all viruses in a test tube, resolve acute viral infections with adequate dosing. Boy, that's pretty dramatic stuff right there, isn't it? So, all viruses, that's how nature works. When we design a drug, it's very specific, but nature has a phenomenal effect. So there are over 64,000 published studies on vitamin C. Okay, and so I don't know what data they're waiting for. 2 controlled studies found benefit with 6,000 to 8,000 milligrams per day for cold symptoms. 3 controlled studies found that vitamin C prevents pneumonia. 2 controlled studies found vitamin C helps to treat pneumonia. These are things I've looked at. 57 elderly patients were given only 200 milligrams And they did better than placebo in a double-blind, randomized, controlled trial. 200 milligrams just. So the expert consensus from Shanghai was published in March 2020. I've had this since then. This is before we had our biggest spike of coronavirus deaths. The Chinese doctors saw the critical need for anticoagulation in COVID-19 patients because they identified that many of them were dying because of massive embolism. And they noted the remarkable response to high-dose IV vitamin C. The reason they came upon this was because one of the doctors in this expert group was Dr. Mao. And Dr. Mao was using high doses of intravenous vitamin C for other purposes. And when the pandemic hit, he said, oh, why don't we try this? And so it worked, and it had dramatic effects. But of course, we didn't want to trust anything out of China. And so we didn't listen. When I had this information, I tried really, really hard to share this information with every intensive care doc that I knew at the hospitals that I was working with when I was practicing ENT. But nobody really listened. Nobody really would push forward and incorporate this even for their dying patients, because it was not coming from the NIH. It was not the standard of care. They didn't want to go beyond that, so patients died. So how many lives did we lose during that first peak in March and April because we failed to listen and learn from China's experience? This statement just always is so dramatic for me. You know, as Dr. Mao discussed one severe case in particular who was deteriorating rapidly. We know that patients can go down the drain very quickly with this disease. He gave a bolus of 50,000 milligrams of IVC. Now that sounds a lot, but this is something in my integrative practice we do routinely all the time. It is not a massive dose for us, okay? But conventional docs are not used to this. So he gave a bolus of 50,000 milligrams of IV vitamin C over a period of 4 hours. We often do this. The patient's pulmonary status stabilized and improved as the critical care team watched in real time. So just as you can watch that patient deteriorate before your eyes, you can watch them turn around. But you have to be bold. You have to use that high-dose vitamin C when the NIH just will not approve it. There were no side effects from any of the cases treated with high-dose IV vitamin C. So, summary of prevention. So let's say you're generally a good, healthy person and you want to be taking some vitamin C because of all the virus issues going on around. So this is kind of reasonable. 500 milligrams one or two times a day for children, and 1,000 1 to 2 times a day for adults. And always a disclaimer, you know, if you have health issues, you really need to know consequences of taking any supplements. I treat supplements as I treat drugs because they can have impacts, and I find them extremely potent, and I can use them just as I would use drugs for a particular clinical situation.